Fortunately, risks and complications for stacked DIEP flap, DIEP flaps, and PAP flaps are low. Serious risks are very low. The most serious would be that there's a problem with the blood supply, feeding blood and keeping that, sustaining that flap, keeping it alive. The risk of that is well under 1% in experienced hands, so it is a rare complication. Other complications, such as wound healing, are a little more common, but can also be greatly reduced with technique, patient selection, and proper flap design.
Experience is probably the most important thing in that. Would you agree, Joe?
100%.
Because with experience, we learn how to take the tissue in a way where we leave enough tissue behind so that the wounds will heal. We get less incidence of seroma, complications, hematomas, and problems like that. And I think that of all the things, we know that as we do thousands and thousands of these procedures, we gain understanding on each procedure so that with each case, we're a little bit better than we were the one before.
100%. And I think visiting your colleagues, those colleagues you respect, those colleagues that are pushing things to a higher level, taking things to the next level, is the best way to continue to improve in order to give the patient the result they need with minimizing the risk of problems.
And it's great because the relationships that we were able to make amongst surgeons that are both, we're all pursuing this same thing, that is better results for our patients, better patient outcomes, less patient pain, and better aesthetic outcomes as well.
And it definitely keeps you humble, because in order to get better, you have to go on the presumption that you're not the best, that somebody somewhere out there has some little trick or some new insight. And so you want to seek that out and continually improve. And so I think it just, it also attracts you to meeting good people that also want to get the best for their patients. So I think it's a wonderful community.